Next question.
So may I?
Yes, yes. Yes,
So
Dr. Panjam.
yes, sir. So diagnosis will be, so since there is a gum bleeding and some photographs shown of a knee which is so from gum bleeding I can make a diagnosis of scurvy. Clinical features will be clinical features of scurvy will be the patient will present with subperiosteal hematoma. So there will be bone tenderness, pseudo paralysis, bleeding from the joints, bleeding from the gums, and radiological signs seen in scurvy are subperiosteal hematoma, white line of Frankel, white line of Frankels. There is a Pelkin spur, white line of Frankel, subperiosteal hematoma, और क्या था? And the treatment will be vitamin C. Yes, sir.
Very good. So I don't know if you're able to see on this, but there is this is the periosteum here.
Oh, okay, sir. Yes.
Okay. And if you see, this is the epiphysis. This is the epiphysis.
Ring epiphysis.
So the epiphysis. Yeah. And it is also dislocated a little bit. That's because of the subperiosteal hematoma. So the diagnosis, like you rightly told, is scurvy. Clinical features are weakness, bone pain, petechiae, myalgia, gum bleeding, hematuria, joint effusions, long bone swellings, and scorbutic rosary, which is going to be a painful condition. Radiological features: white rhinopharyngeal, traumafield zones, Wimberger's ring, pelican spur, thin cortices, decreased trabecular with ground glass osteopenia, subperiosteal elevation, and epiphyseal separation. All of these can be seen. Treatment is vitamin C replacement. Okay. Now, it is very nice of you that you caught it only with the gum bleeding. Okay. Another condition where they can show you the teeth, where there is no bleeding but decaying tooth, and you can pick up things is
fluorosis.
Okay, there could be fluorosis. You can pick up osteogenesis imperfecta because it comes in the triad. Dentigenous imperfecta is part of the triad of osteogenesis imperfecta.
Yes.
So achondroplasia, they can show you pictures of the teeth, and osteopetrosis also. They'll show you a dental radiograph, not the tooth as such. Okay,
so what will they show in achondroplasia, sir?
Achondroplasia, the lamina dura. I mean, if you know how to read the dental X-ray, it'll be easy for you. But the lamina dura is one of the layers of the tooth where it sits into the gum, into the mandible. So that layer is thickened. Okay, it's not necessary, but remember, if it's a decaying tooth, it can be dentigenous imperfecta. Fluorosis is another condition, and then there is very, very rarely, they might not ask you, there can be heavy metal poisoning, because of which they can show you tooth photos also.
Okay.
This is from Professor Gopakumar's collection. So who wants to take this?
May?
Yes, Dr. Anju.
So there seems to be a dwarfism which is more prominent on the upper part. The upper segment is high than the lower segment. So this goes in favor of rhizomelic dwarfism, which is achondroplasia, sir.
Okay.
Radiological features will mostly seen in the spine, which is in the form of decrease in the height of the pedicle, which results in a spinal canal stenosis, bullet-shaped vertebra. In the pelvis, there will be a champagne glass pelvis, and there will be V-shaped effect in the distal metaphysis of the femur. And one more radiological features, and there may be a genu varum. Gene involved is in achondroplasia is FGFR23. Mode of inheritance autosomal dominant, and the orthopedic problem encountered is spinal canal stenosis, genu varum. There may be a scoliosis, and So that's it.
Very good. So, like you rightly told, the radiological features you've mentioned, out of the 8, you've mentioned 4 to 5 straight off. So that will give you full marks on that. The gene involved indeed is the FGFR 23 gene. It is indeed an autosomal dominant, FGFR 3 gene, not 23, FGFR3 gene, which is present on chromosome 4. Not important. If they ask, it's on chromosome 4. It is an autosomal dominant condition, and the orthopedic problems involved, like you rightly told, is spinal canal stenosis, genu varum. There can be craniovertebral compression as well as short stature, which is rhizomelic. So basically, what is rhizomelic dwarfism? It is where the proximal parts of the limbs are shortened. A mesomelic dwarfism is where the distal parts are shortened, and then there is acromelic, where the complete tips are foreshortened. Okay, like over here, you can see the V-shaped distal femoral metaphysis in the images. You can see the champagne glass pelvis as well as the trident hand.
Yes.
Okay.